Okay, there we go. All right, now let me switch over to this other because you're picking up my audio.
So how do I take it?
You just have to turn your speaker down, your volume down. And so that way you won't hear anything on yours. But at least we can tell that now that's working. Um, keep an eye on that mixer there so you can kind of see. Tell me, still making, can you still see me talking? Adjusting.
Yeah.
Is it still doing that? Okay. On your computer, can you hear your volume? So then just can you tell me that you're hearing me talk out of your computer?
Talk again.
A little bit. Try it again. Is it a little bit? So I don't know where that one's picking this up from. Echo canceling speakerphone somewhere, and then this audio device is somewhere. Oh, let's see how this is a little bit. Okay. I'll test a little bit. Can you hear anything from me coming out? No. So we'll have to use that.
I was gonna say try it that one.
Okay. So on this one, you just have to, well, it is coming from wherever I am here. Testing, testing, 1, 2, testing, testing. How's that?
I can hear it. It's still
Icicle.
low.
Icicle. Testing, 1, 2, 3.
It's picking up this local mic.
Well, we'll do that because that way he'll hear you, but then when we have to go into the audience, we'll use this.
Yep.
Does that make sense?
Yep.
Okay. It just has to be pushed once and it'll turn green. So if you hold it down, it resets the whole thing. So yep.
I think so. All right, everybody that is on Zoom, if you would go ahead and sign in for me, I would appreciate it. We're going to start in about 5 minutes.
Hey, Carrie, I couldn't quite hear you. You're cutting out. Can you say that one more time?
Hey, I can hear you fantastically. Okay,
Cool.
everybody who is on Zoom, if you
Yeah,
could,
you're
please sign in. We're going to start the meeting in 4 minutes now.
Thank you, Carrie.
You're welcome. All right. Can you? All right. Can you hear me now? Okay.
I can hear you
So
online.
just so that you guys online know, I am not monitoring the chat. And we are not doing any chat input because we don't have that capability here. So we're not doing any speaking input. You can put all your stuff in the chat and I'll catch it later. But we won't be replying to any comments. All right, with that, I have notes, so I don't have to stand back. I would like to welcome everybody to the first 2026 Travis County Health Council meeting and our first community listening session for, I like to call it video. It's the VHRIA, but video sounds better because everything is better with tacos. So what we're going to do is we're just going to go ahead and open this meeting up. Is there a reason it's flashing?
Yeah.
All right, let's try that again. So we're gonna go ahead and open the meeting up to the Health Council, then we'll move it into the listening session. For those of you online, we will go into a 25-minute breakout session here in the building. Online, we have it set up so that you can do a QR code. So if you want to go ahead and scan that, you can go through the questionnaires at 10 o'clock. We will come back into the meeting and open it up to the input from the group. And so you'll have more of the discussion on the behavioral health piece. Sorry, I know I'm talking. You guys having a hard time hearing me? Okay. I know this is a little weird and it seems confusing right now. It's because this was created at 11:30 yesterday. This one I got notice that we were in charge of putting the whole thing together. For those of you who don't know, I'm Carrie. The mic went off.
Just have to yell loud. Guess they're baby steps.
Can those of you online hear me? If somebody can just give me a thumbs up.
Yes, I can hear you.
Okay, that works. Okay, so apparently I'm going to stand here now so that those online can hear me. So those of you who don't know, I'm Carrie Moore. I'm the director for the Travis County Health Council. Welcome. The Behavioral Health Initiative was created in 2025 through 3 different Senate bills. There was Senate Bill 1 that created a $10 billion behavioral health trust fund. It's their long-term sustainable funding. SB 2 created a $200 million one-time investment for planning, outpatient care, and crisis response housing. And then SB 3, which is kind of what we're doing. This is the legal framework and the regional planning to be able to utilize the money in SB 2 that SB 1 will eventually fund throughout the rest of our life, if that doesn't make any sense to you. So the purpose of today is to hear directly from participants, your experiences, your ideas, your priorities when it comes to the regional planning and our future funding. So a few ground rules. This is supposed to be a safe space. You can speak from your own experience, respect others' perspectives, share the space. Everyone gets a turn. Brief comments. Speak again only after all have spoken, and focus on listening as much as speaking. The other thing I will ask you is that this is being recorded and will be put up on our YouTube channel. So if you talk about clients, do not use names, keep it general references so that way nobody gets pinpointed on that piece to it. I would greatly appreciate it. So what we're going to do here to start with, we're going to do a breakout session. We've got it broken up into 4 different questions, which is what the QR code is for those of you that are online. We're going to do is break into these, go over the topics, answer the questions to it. We're going to give you 25 minutes to do that. And then we'll call you back in and then we'll start discussing it and start putting the information together. So the breakout sessions, and those of you online, if you need to step out of the meeting until, shoot, I'm really fast, till 10 o'clock, my recommendation is to be back into the meeting by 10, but you can always keep this recording going and you may hear something, you may not, I don't know. We'll see how this works. This is our first kind of weird hybrid version of this in this big room where we don't have access to actually be interacting with Zoom the way we normally do. Sorry, guys, it's kind of weird. So if we can go ahead, we'll do that far back table without a tablecloth on it is 1. Over here where Rebecca is will be 2. Where Valerie is will be 3. Where Jennifer will be 4. So spread out. What I'll tell you is that our breakouts, so group 1 is setting the tone and strengths. It's the community strengths, what's working, what's guiding values. If you're interested in talking on that, you'll go to that table. If you want to talk about challenges and opportunities, access and barriers, our biggest barriers, impacted groups, potential solutions, will be this table. Alignment for local solutions, collaboration opportunities, existing solutions to scale, missing resources. That'll be Val at her table. And Jennifer is community voice, trust and readiness, trust in systems, ways to increase engagement, readiness for change. Everybody get that? Yeah. All right. Number 1, if you are interested in setting the tone and strengths, community strengths, what's working and our guiding values. Back here on the end table. Rebecca is the access and barriers, our biggest barriers, our impacted groups, and our potential solutions. Val is alignment for local solutions, collaboration opportunities, existing solutions to scale, and missing resources. And Jennifer is community voice, trust, and readiness, trust in systems, ways to increase engagement, and readiness for change.
And if you look at the work code, you saw group code kind of questions. So like something on that group question. So to me, it's the same question.
Yep. So if you'll go to those groups, everybody will have an opportunity to have input when we come back together because we'll open it back up to everybody having access to it. Okay, so this will just be the short version. We're just staying at the 1. So you're just going to do the one set of questions. It's 3 questions per group. And we'll do this till 10 o'clock, and then I'll bring you back into opening it up.
If somebody
Does anybody else have that?
So we have about 20 minutes for the answers to the questions and discussions.
I deal with stigma myself. I am not doing
Like this, I'm not gonna knock it down. But like when we, at some point in time, we might give them another manager to scan that QR code if they never submitted their own answers, because sometimes they've just gone into it and never did anything. So just a thought, at some point in time, like during discussion, after discussion, whatever makes sense. All right.
Okay, for those of you on Zoom, I just put in a tiny UR link that will take you to what the QR code was sending you to. So if you don't have the ability to scan the QR code, you can click the tiny URL link and it'll take you to the questionnaire, which is what everybody is working on right now. And if you have any questions, I do have the chat box up for now. So now's the time to hit me up. There, I realized you guys were on mute. We got about 4 more minutes and then we're going to open this back up to everybody for discussion.
The people that have the sick ones.
All right, if you guys want to go ahead and wrap it up, you will need to select somebody who is your speaker for your group.
Okay. Who's writing stuff down?
She did.
Okay.
You didn't set your mouth. Hey, you're not.
Okay, everybody has chosen. So.
All right. If we can, go ahead and pull this meeting back together. Let me make sure everybody online is visible. All right, we are there. So what we're going to do is we're going to have whoever the speaker is of your group, so that way we can get to the information on Zoom. And the reason Zoom is here is because I need the recording, right? Otherwise, I would have to be taking notes, and I can't lead a meeting and take notes at the same time. It's impossible. So that's why we're doing it this way. So we're going to start with group 1, which is the, give me a minute, I know the answer. Tone and strengths, community strengths, what's working and what's guiding values. If the speaker for that group would like to come up here to the front. Come on, Kim. All right.
Okay, we have representatives from the Department of Health, the judicial system, and comprehensive, I guess we're clinical care behavioral health and primary care. So what strengths already exist in Chaves County? We all agree that there are quite a bit of strengths. The Behavioral Health and Wellness Committee that exists within the Health Council, 100% Chaves, a very strong faith-based community, individuals who care deeply and show up whenever the need arises, disaster relief, Pecos Valley ER, emergency response, Wings for Life, DWI prevention, RASD school providers, DOH, people who are our culture that is very passionate about families. Housing coalition, shelters, 211, law enforcement, and La Casa. Number 2, who in Chaves County is most impacted by behavioral health challenges right now, and what do they need most? We didn't get to that second part, but we think youth are probably the highest need right now. People facing competency in the court system, those needing housing and consistent medical care and insurance. Those in crisis, immediate crisis, where do they go and where do they go from there once they are addressed? Juveniles who are already in the system. And then what signs tell you behavioral health challenges are present in our community? And what do you believe is driving them? Well, we all agree that a lot of the problems that Roswell is facing are happening across the country, that they're very common to other communities. Homeless, number 1, is a sign that you see right away. Incidences of suicidality in the schools. Calls to the ER for substance use, familiar faces being seen over and over again in the court system. Those were just a few. And then what do you believe is driving them? Laws in the community drive norms. Lack of cooperation and coordination among the resource providers. So that's ours.
All right, thank you. Yeah. So now we'll open it back up a little bit. So those of you in the audience, if you have input on any of the questions, state it really, really loud so we can capture it. We are going to write down the questions so that we have them, or the answers. So does anybody have anything to add to what strengths already exist in Chaves County that support healing and resilience, people, organizations, tradition, faith, culture, programs? Anybody online, if you want to answer that, you can do it in the chat, and I'll keep track of it as we go. Nobody has anything? Wow, look, Kim Y'all's group's fantastic. You had everything. Okay, anybody have input on who in Chaves County is most impacted by behavioral health challenges right now, and what do they need most? Youth, elders, veterans, rural residents, Spanish-speaking families. Any input? The houseless, the unhoused? Anybody else? All right. More child care? So like more child care providers? That's good. So yeah, so free childcare for the state is just starting, and we're not 100% sure on where that's working out. But what we do know from what we're hearing everywhere else is that providers will become an issue because we won't have enough providers now. Anything else, Val? So more of a real-time provider scheduling system. So that way, if provider A is busy, they can go to provider B and try to fill that need in the time of crisis. Okay, so open it up, no gatekeeping, have it all agencies, real-time data on availability. Okay, anything else? Free? Safety net for those coming out of Sunrise? Food, shelter? Okay, so a catching place for those coming out of Sunrise to encompass all services needed going forward. Okay. Basic needs with behavioral mental health issues. There you go, continuity of care. I've been reading a lot on that one. Any other facilities coming out of?
Services for health. They can't get like they do like diagnose for their work, let them know, but I'm struggling with that right now.
Services for those with disabilities to be able to, with learning disabilities. Okay. All right. And then with that, that is the end of section 1. So now we'll move to section 2. Section 2 is this table here. It's challenges or opportunities, access and barriers. Really loud.
Question 1 was, how does stigma or fear of being judged affect people's willingness to seek help in Chaves County? We put cultural stigmas, feeling of not wanting to share info, barriers of religion and healthy mind, accesses to services due to fear, gender stigmas, feelings of being weak, and family expectations. Number 2, where do the systems break down most often? Referrals, follow-up, crisis response, discharge planning, eligibility coordination. Barriers, window of waiting period to receive help. More of a smooth transition from crisis to support. Lack of natural supports until professional supports. Lack of local help.
Speak louder, I'm a little older, I can't hear.
Lack of local help support after hours. He knows what I'm gonna-
Go ahead,
Whose voices, cultures, or languages are not well represented in the current behavioral health services, the mentally ill, veterans, youth, and low income. And that's what we put.
Okay. All right. So thank you. Now we'll go ahead and open it up to community input. So the first question was, how does stigma or fear of being judged affect people's willingness to seek help in Chaves County? Anybody else have any input into that one? We need to Okay, so reducing the stigma because we are a close-knit community and then our culture has a tendency to restrict how we perceive our perceptions. So we need to do a better job at reducing the stigma. Okay.
And you say one wrong thing, it gets reported to VHS, and what happens? They get for innocent, and that makes them even more psychotic up here, because they're like, well, I'm taking care of my kids, I never hurt them, I'm providing for them, but as you're struggling up here, some providers, not all providers, but some of them will refer you to VHS. Is the way it's taken. So I think that more of the fear with people who have is the environment.
So from that, and what I'm doing, so everybody knows, is I'm trying to summarize what's being said on the floor so that those online can hear, because nobody else can hear you online. So the summary of that one is the fear of losing your children whenever you talk about your mental health. And so we need to find a safer way of being able to address that need without the fear of exacerbating the situation with now losing my child.
Some of them, they judge you being unsafe to be around their children while you're getting that help, and then VHS comes to your door, and sometimes you don't get your kids back.
Right. Okay. Is anybody else? Okay. The next question is, where do systems break down most often? Referrals, follow-up, crisis response, discharge planning, eligibility, coordination.
Follow-up, I would say follow-up, because we don't have the resources available in one area together, like a one-stop shop. You have to go to, support business all the way over here on Sunset, and you have to go to DMV all the way over here up north, and people don't necessarily have transportation or the need to get here and there. Most families today are working 2 jobs in busy. The bus system, runs up and down Main. But then who wants to sit in the hot sun when there's no covering or the rain and all that stuff? Again, community heads that run the state, they say that they took away those things from them. So I think that's where the adherence to getting back and getting the sense, back to the second.
Okay, so the follow-up, because the resources are spread across the community and not easily accessible. Okay, anybody else?
A lot of our students that just started being therapists, they get discouraged to continue when they learn that the therapist they have is no longer going to show up the next week, and they have no notice about it. So they go on to restart somebody else, and they put the person in some cases at because they hesitate to go back, and then they let down like versus allowing the provider to be able to prep them and hey, this is going to be my last day. This is what I'm going to be sending big. And a software more handoff, which is that's complex. But this seems to be consistent with we have that going on. So a lot of times I can hear someone that is there to like, oh, it's going to be weird. I do that. Because I was so excited. Then the following week, I had an appointment in here, and we were there. We were no longer there. And I think it's
Okay.
also really.
So hang on, I'll forget.
Okay, it was just off.
So a better discharge planning process to be able to utilize warm handoffs, so that way the follow-up care is more consistent, or they're more willing to do the follow-up care, so that way they're not starting over from scratch with a stranger. you. They know who you are. They know everything. And then if they're going off to someone else, they're gonna know nothing about that person. So if you're trying to talk or Dr. Riley, Dr. Ryder should be like, hey, listen, this on this person, study it, get to know them, and then you know what I mean. Get what I'm trying to say. So that it's not like they're starting off new. They already have an information about that person, and they can kind of have an idea of what they're going into instead of asking maybe the same questions or just them going through the whole process again. Okay, so again, referring back to more warm handoffs, so that way the practitioners are familiar with the clientele as they're coming in and being more welcoming, familiarized, not so scary.
Is that, there's no real safety department, I think from now, we are getting a lot of transported from surrounding areas. To Sunrise, and after their 3 to 5 days, they are on the street, and then that becomes non-profit community, workers, responsibility or we have to pick up the class or we need a connection. And I know that there's involved, but also the state district plan thinks that they will have follow-up care, they have somewhere to go with it, or they got the transportation to get home. In just last week, like children from Gallup, down to Sunrise, to the street. 2 nights here to sleep on the street when we could have got him on the bus that same day. But he has to leave outside for 2 weeks before we get him a bus back.
So discharge plans with the resources. Shrink that down for me. Sorry, you got wordy.
Safety plan.
Safety plans from the behavioral health release to coordinate with services to, right. So creating a safety plan for discharge. So that way they're not ending up on the streets and no resources available to them. Okay. Last one. Yeah. So the breakdown is from the top to the bottom on every single thing that was mentioned due to personal experience. Whose voices, cultures, or languages are not well represented in current behavioral health services in our community? Anybody have anything to add to that one? Spanish speaking providers.
And the ones that are here.
Louder, I can't hear you.
I took it again, and I didn't intentionally do my name policy. But I observe when I go places where there are decision makers, and I don't see a representation of the population amongst the decision makers.
So
Does that make sense?
we don't have a true representation of those creating the plans to come together to represent the community that they're supposed to be making the plans for. Like as in this meeting, there's no Spanish speaker holding this meeting because I don't speak Spanish.
Yeah.
Oh, no, trust me, I know, I got it.
That makes sense. But just go and look at the county, go look who's been running the county, go look who's been running our city council, and look at the history and see if it represents the majority of the community population.
Yeah. And I'm not going to get on a soapbox on that one because we will never get out of this meeting. Go ahead.
We're not gonna get anywhere until we get city to get one of us. Oh, yeah, because we have to.
All right, for those of you on Zoom land wondering why there was clapping, the response to that was that we're missing the input and the communication from the local government, city, the county, and having their input and having them at the table to be able to help work through these issues, because there's no communications going back and forth on that side as well. The LGBTQ community is missing on the partnership. On the voices.
Yes.
Okay. All right. Now we're going to go ahead and move over to section 3, which is the alignment for local solutions. Val's going to come up here and talk really, really loud.
All right. Okay, what partnerships would make behavioral health care more connected and effective in Chaves County? For example, what schools or health council clinics, law enforcement, faith groups, or youth organizations? We talked about a lot of things for this one. I think we spent most of our time on this question, but there's no more school-based health clinics, so reaching our young people, whereas before that they had access to both medical and mental health services in the schools, now that's not accessible. Our community is not connected, so this goes back to the comment that we made about providers putting people on wait lists instead of sharing the resource or sharing the ask for help with other providers. They're putting them on a wait list, so we're kind of like territorial, or we're not wanting to do what to serve instead of serving our own agency. We're not serving those who are calling us, who are asking for help. The partnership of accessing the 211 information line, that's a partnership that could help us keep us connected in a way that's not, it doesn't have a stake in the game. It doesn't have anything to gain but to share information. Using 988 as so I think we talked about this. 988 is being used as a referral system. So some communities are using 988. For example, if somebody calls for accessing resources for crisis or for accessing for help, they're using that as a referral system. I don't know if that was its intent, but that's certainly how it's being used in some communities today. And then, of course, law enforcement, using having them trained with crisis intervention and being able to respond to emotional behavioral health crises in our communities. So that was number one. Number two, how can Chaves County grow and sustain its own behavioral health workforce? For example, training locals, peers, incentives, youth career pathways. We talked a lot about the community health workers and how our state is using community health workers more and more in today's practice, and how obviously lived experience is vital, and to be able to connect with those who have a crisis, who are experiencing some shortcomings. So community health worker training and sustainability, I think that's one of the things that we talked about, because we can have and we can train community health workers, but sustaining them, right? Helping to teach them to build their practice, to teach them how to be sustainable by billing Medicaid and earning a living. You can be a certified health worker, but you can't earn a living, just being a solo practitioner that way. So that support and building them up and pouring into them would go a long way. Other professional kind of trainings, especially as it relates to therapists and counselors. If you think about the southeastern corner of New Mexico, anybody who wants to be a therapist in this community or in this area, they have to travel, right, to any other metropolitan area. And most typically, those people that go to get trained, they stay there. They don't come back home to provide the services that are much needed here in this community. So that was the example that I used, is that we need to start creating opportunities for people in this community to be those professionals to provide the services here so they can stay here and continue to help build our community members up, help them recover and restore and be who they were meant and called to be. What community-led, cultural grounded approaches are already working and should be expanded. Churches, and that's all we have here. And I can't remember because I think we ran out of time. Was that anything else, guys? So they're not very open to those that are really seeking to help provide help in our community. So if you don't belong to that church, or if you don't believe to that, whatever that church's belief is, they're not going to let you in their doors or to help be a resource. So that's us.
Okay, so thank you. We're going to go ahead and bring it back up to the top. So to add, what partnerships would make behavioral health care more connected and effective in Chaves County? Schools, health council, clinic, law enforcement, faith groups, youth organizations.
But I really think that we need more people for adults and children with autism. We need more help with autism.
More autistic services.
Yes.
So I need to get you connected with the autism group that's now here. Okay, who else?
Making sure that we encompass all the way past the third year, Jamestown.
And I will reiterate that part, is making sure that our resources and our information is spread out to the valley, because we do go all the way to Lake Arthur, and Lake Arthur is kind of a split. If it's a county service, they have to come into the county. If it's local, they can go to Artesia for some things, but we have to be able to reach out to them as well. And we don't do a great job of hitting the valley. And then I think it's even worse because there are some communities inside, like the Boot Hill, and then up going towards Portales. There's another set of groups in there, just because they're not organized or incorporated towns. We kind of miss out on that, but if it's a Chaves County service, they have to come this direction for it. So we need to make sure that they're aware of it as well. Anybody else? All right. How can Chaves County grow and sustain its own behavioral health workforce?
That I think is the barrier right there. I thought when I went to school here at Eastern New Mexico University, Robert, that was the jobs that were going to be provided when I got out. But there were salaries, right? No, the jobs are available now.
So creating the facility after you get trained to be able to work, because we're lacking in resources. Anybody else? All right.
Businesses and the agencies that do these services being able to support their own staff into those positions and offer them opportunities such as paid tuition, educational leave, and so on, so that they're working here, they like the community, so now let's encourage them to move on and further their education so that they can stay here and then provide them further service.
So having the local organizations train within to be able to boost them up to get trained and stay within the community. Okay. Yeah, I had something and I forgot it. Anything else on that one?
I feel we need more resources to make sure families can keep their husband, because no matter how much you work, you still can't provide rent, or you have to choose between rent, electric, heat, water, and then, you know, you have kids on top of that. So you gotta make sure you get everything to kids, either you can't buy what your needs and pay rent, to keep the roof over their house, or you buy what your child needs and then get a 30-day notice because you're not paying rent, because you need to get what their children need in the house. So like more help in that.
More resources for social determinants of health. Preach to the choir, girlfriend. All right. What community-led or culturally grounded approaches are already working and should be expanded? Okay, since my thought came back. Funding, being able to grow your own, we need to be able to build our own, right? Because one of the problems that we're seeing is that Santa Fe, Albuquerque, Las Cruces, that I-25 corridor has the money, they keep building, they have the housing, they have the behavioral health. I mean, their populations are a lot bigger, but they forget about the rural communities. And funding coming into this direction of the state is very lacking. And it's not that it's not available, it's that we don't have the connections to go after it. So some of it is working within the government because they have to be the fiscal sponsor or the fiscal agent on it. The other part of it is don't necessarily know that those are available, and so don't know how to go for it. And then not working together so that way I want this piece of the funding, but you take that piece of the funding and let's collaborate. The collaboration pieces to be able to expand, I think, is huge on that one. So what community-led or culturally grounded approaches are already working and should be expanded? I think 211 is working. It definitely needs to be expanded. But with that, it needs the input from the community because we only know what we know. And if we don't know that something is out there and it exists, we can't provide that information to the people who are looking for it.
It also needs centers, like we lost our youth center, we never got that.
So youth and teen centers.
That like one of the most. No, reach our youth. We're gonna continue on a cycle of where we're at right now.
Is very unusual, but it is expanding and we're getting the word out how it is. You can expand what rather than something is considered about all I know that really what we can focus other groups of the focus on that. We don't stop for that high.
So CASA's Family Resource Center is working. It needs to be expanded on so that way we can reach further. We need more outside agencies in the resource center. More community partners.
They have available hygiene kits. And again, we create that one-stop shop where like hygiene be there, you should ID there, medicine there, there'll be pharmacy there, then that would be a real solution business. Where we keep those people who are trained here in Chatham County, they want to work here, and you can help the community that segment.
So I'm just going to add this piece to it just because of the 211, and we refer to CASA Family Resource a lot. There's stigma with CASA because they are the court appointed specialists, and so they're afraid to that stigma. They're afraid that somebody will take their kids away if they know too much about them. So I don't know if there needs to be more of a neutral based one. the idea or expanding on, or CASA's Resource Center is what we need. We need like that, but we got to also figure out the stigma that's associated with it as well. Anybody else? More adolescent shelters? So legislative changes to be able to increase our adolescent shelters and create that federally funded one on that they want to be able to work, whatever it was called. In my head, I know what the answer is. All right. So now we'll move to section 4 for community voice, trust, and readiness. Stand on this side so you're mine. I can't hear you.
Okay, I will speak very loud. Thank you, Eastern New Mexico University, for providing this beautiful building, ITC, for Carrie Moore to host this behavioral health. Our first question was, what would help build more trust between Chaves County residents and state agencies, local government, and other behavioral health organizations? We came up with more resources, housing, shelter, affordable rent and not being rented to, and those who have trouble because of their criminal history, access to doctors, facilities, empathetic doctors with no egos, being treated as a person, communication, cooperative government, and transportation. Number 2, how should families, youth, and people with lived experiences help design behavioral health services? Communication, share experiences, rely on local experts, interpersonal communications, whether they be with me and Carrie as individuals knowing each other, your staff, who you work with, your employees. These are all interpersonal communications that we can all build on and learn from each other and pass them to each other. Have more meetings. Number 3, where do people in Chaves County feel safe talking about behavioral health and how we can grow those spaces? In their own crowds. We were talking about we need more Spanish speakers. Yes, they will feel more comfortable there. Close friends, community support meetings. I had a little pause there because I was like, sometimes people will ask me questions and I didn't know the answers. And sometimes we could be the blind leading the blind, and we need to recognize when we're the blind leading the blind and let somebody else take over and contact those people. Grow and invite people back, make it a safe and inclusive space, just as Carrie did when she opened up the space for this meeting. Thank you.
Never been accused of that before. Just saying. All right, opening it back up to the floor. What would help build more trust between Chaves County residents, state agencies, local government, and other behavioral health organizations? Geneva? To get the elected officials to the table to provide the government support.
We are their constituents. We are the ones that elected them. They need to hear what issues is being with each, you know? Sometimes when we hear, when we give them a report, what do they do with it? So we need our local government.
We need our elected officials to be present and hear.
Are these all presented their time?
Okay.
Even or and you hear it over and over with water.
I'm gonna say a lot of communication is lacking between like
for instance, the city council and the communities, as well as the officers and even down to the DA. I grew up in a situation to where I almost died at 17. And I know the laws are different then, but even up to this day, the police department got rid of my, crime record where I was a victim and almost died illegally. And I have lost trust in my community when it comes to the people that are, officers or anybody, I mean, Geneva will be with, so that I have very hard time, trusting a system that, hurt me as a child, and I don't know how to get over that. I don't know how to work with them. And so there needs to be some kind of meeting where they sit and listen to what was done to some of us in the past and why we feel the way we do. And that's why we have so much crime and stuff, because of we have this repeated thing where we don't feel safe with the people that should be taking care of us.
Okay, so again, having the state agencies, the local government listening to the people and their needs and wants. Val?
This is the answer to all my problems, but you still don't have the existing framework to give. So I think the part of the trust needs to be built up in the sense that it makes sense to, what is the role of the government versus the role of the community versus the role of the so that way they're coordinating collectively, right, work towards goals that are beneficial to the entire population instead of beneficial to maybe you or beneficial to none, right? At the end of the day, all of that has to make sense because those of us in the front lines, those of us who do live paycheck to paycheck, but who don't make ends meet, right, have a much different perspective than something that they can do that, so they can see that reality. I think we're all just really trying hard to meet the needs of those that are most inclusive. We're really trying hard to put the gap, but then there's so many gaps to continue to be like Sam. So working together collectively in a way that is trusting, a way that is meaningful, that we will be able to all be at least. And right now it's just kind of a hodgepodge, right? It's just kind of hashed out here and there, but not really going.
So clarifying the roles of the agencies, the governments, so that way they know exactly where they're supposed to be so that they can start building the trust within their roles. So the so much so that I don't know how to shorten that up for Zoom. Okay.
Clarify the goals, roles, and responsibility and accountability for government.
So clarify the roles,
Roles,
responsibilities, goals, and accountabilities.
Yes, you're
just wanted to say real quick, Arnold, the counselor is online, wants to do this COVID, and she wants to respond. And so I take back, and counselor.
So the reality is that we do have a City of Roswell counselor online. We have a City of Hagerman counselor in-house. We have a City of Las Vegas, Lake Arthur in-house, and we have a representative, a city councilor from Dexter in-house. So we do have an elected official from every incorporated government agency with the exception of what?
You forgot about, I am the New Mexico State Representative for Boston. I know it's
Yeah, it's not local.
something you don't know. Yeah, I am the New Mexico State Representative.
Okay, so just going back to trust in government and systems, is a better understanding of them, because I think that in general, there's a distrust over, that they're always trying to get over on it, but without explaining things, it creates that attitude. So I know that if you ever get on Facebook, there are hours worth of complaints from locals about fees, but there's never a clear explanation of why. People will complain about those signs that we have. Well, they spend so much on this, but yet we don't have homeless shelters. They're very different funds. You know what I'm saying? And why do we have to sign here? Like those fees, but it's just a generalization. Instead of finding out this, not this. This money's not for that, not some spend. Or why are they, why is this getting something or not? There's just never an explanation to have people know that the way things work is not how we do it. On this, that is true. They're just left there angry and complaining and not understanding. I know that people are like, well, why doesn't the city have a trampoline park? The city doesn't really, you know what I mean? Like, they can be more welcoming to business in the Roswell, but they don't start business like that. These are people, companies, but they're just left in the Russian and not in things to So more communication, understanding the roles of the government and the agencies on what they're supposed to or not supposed to do. We're running short on time, so.
Just real quick, I think major factors of building trust between anybody is of course your voice being heard. Whether you're a constituent or you're a leader, your voice needs to be heard in that. And I've worked extensively with youth, and I hear it all the time. You're not listening to me. You guys don't listen to me. And it's not that we're not listening and hearing. It's that when they express their voice, they want to make sure that there's action as a result. So don't just listen and don't do anything with it. So I think we could learn from that in our youth when they're telling us, listen to me, listen to my voice, help. But what's the next step? So as leaders is not only taking the time to listen to what the needs are, but also putting those into consideration on the actions that we take and everything that we do.
So listening and then putting actions into place to make sure that we follow through on it. And
Next time, they're not going to say anything because you didn't do anything what I told you with.
right. No lack of follow through. So with that, since you mentioned youth on that one, I feel like I should go 6, 7, and then we're moving on to the next question. So how should families, youth, and people with lived experiences help design behavioral health services? Is that where we're at?
Yes.
Anybody on that one? All right. Number 3, where do people in Chaves County feel safe talking about behavioral health, and how can we grow those spaces? Scanning. Friends, family.
Some people want a provider that can be honest with them. We are not good at, they're not good at promoting or supporting or sending those types of services. You have and they are very powerful, but they don't have very many. And I think one is because we're
very well versed in its function and how it's supposed to help me as a person, right? So like I met with somebody who needs a support group, safe space, offer everyone, but he had very good time with this support group, right? And so they're powerful, they're helpful, they're useful, but we as a community need to help continue to support that. So that way, that support group is successful, maybe we can create more support groups for those populations that need that, right? Like for the youth, for elderly, and for those at risk, and for whatever population. I think at the end of the day, if we have this support what's trying to be launched here and now, how do we bring other cities? How can we create more of them and get those other nonprofits? I think it's really vital for us to kind of what is out there and what is happening now? How can we support? How can we promote them? You know.
So promotion and supporting those that are already in existence, and then helping spread it so that way we grow more love. Anybody else? Geneva, you'll be the last one. Yeah. So Christina, unfortunately, we're not set up so that we can hear you. Well, okay. Hang on.
Is it just because it's not turned?
I don't know.
I think that because people have been talking, she just has to unmute, I believe.
Oh.
On yours, are participants muted?
They're going to unmute you.
Participants, and then if you find Christina. Oh, well, she's not in the meeting then.
Oh.
To what? To not talk?
Okay, Christina, whenever you get on, unmute yourself. You should be able to.
Okay, can you hear me?
Okay.
Okay. All right, thank you so much. I'm so sorry. I am working as I speak. So I just wanted to bring some things to light to think about. I've heard the comments on the local government engagement, and I'm absolutely going to say you're not wrong. But I want to kind of point out what I've analyzed from our local government and where the issue lies in getting the connection between creating the support for behavioral health. First off, many of these elected officials, well, none of the elected officials have an education or a lot of knowledge about behavioral health. And a lot of the issues, they definitely don't know the solution. And so you combine that with generations who actually who are in office now, but still have a mindset that behavioral health is not necessarily a taxpayer issue. So that is one roadblock that I believe we have in Chaves County. Also, the city considers and the actual role of public health is really assigned to the county. And so the city has areas where the police department could actually improve on community connection and a couple other areas. And I do believe that we are working to put people in that have more of the criminal justice reform mindset. And so I want to say another area is funding. When I was trying to get things passed, my biggest hurdle was that the other leaders do not want to actually put money out to something that is a continuous payment. So they don't want to fund things over and over again. So if we build, just like if you build something, they don't want it. They want it to be a one-time out payment, but not a continuous line item. So that is a huge hangup. Just like I can't even get Portland Loos in because I can't get bathrooms on Main Street because they're worried about funding the maintenance. This is a mindset that we have in our leadership, and it's across the board. So, providing the fiscal resources is very hard. The other the issue is the consideration of liability. The state puts a lot of requirements on the institutions that set up here, and if we give funding to it, then they have to be credentialed in a certain manner. And that's across the board. So that's something that we actually should look into. And that's why I kind of wanted to say some of the things that we could do are in the future, get someone on council, get someone, make sure that our county commission at least has someone who has a health background. Because you have an irrigation specialist, you have an accountant, you have a guy that worked for land management. I'm just saying, they aren't even educated, and that's why they don't sit down, because they're intimidated by the topic and by what the possible solution is. Could they screw it up? So that I bring this to the table because instead of getting frustrated with them, understand the issue, and then we come up with a solution. And many times that has to do with who we put in office. And then the last thing I wanted to say to the lady that spoke out about being, afraid of the police department and frustrated because things, just situations occur. And I myself am very familiar with that. And as a person who has been inside trying to create change, the best thing that our citizens can do when things like that happen is actually create reports to the ACLU or to the state agencies, because until we have those incidents reported, it is very hard for me, even on the inside, to create change. We have to identify the problem. And so I ask of the public to please keep me informed. Let me know when things like that occur, because many of your counselors, they're not, many of them don't even know what's going on, not because they don't care, but because they aren't in the same rooms, they're not having the same experiences. And I learned to fix problems by the people that report them to me. So I just kind of wanted to throw that out there as input on how, we can dive into evolving the current leadership and then creating leadership down the road that is very astute to the problems in our community. So that's all I wanted to say. Thank you very much.
Okay, so we're not debating. So we're going to go ahead and move on with the meeting. I'm going to go ahead and move on with the meeting. Christina, if you could go ahead and mute yourself. You can, that's an outside of the thingy. So at this point, so our next steps for this part is we're going to compile all this information. We work with the LC5, which is the judicial district, which is Eddy and Lee County. Not sure where all this information goes and how this is all working. There will be a workshop planned in the next couple months where we'll come in and start actually mapping resources within, it's called SIM mapping on that one. Once I get the information put together, I'll go ahead and I'll release it out so that way everybody can see what we talked about here. So that is the end of the community listening session part. So from there, we move into the rest of the agenda on the Health Council. And let me pull that up. All right. So we started the year, which is 2025, with 95 members. We're now up to 124. Would like to say welcome, James, Ruben, Joseph, Joe, and Anthony. The agenda, the minutes from last month, which was November. Nope. Yep. I don't know. Some month ago. Was sent out with this. Is there any corrections to this? If not, all right, moving forward. New business. So every 2 years, the Health Council creates elects a new board. So notice, this is your notice of opening for self-nominations. At our next month's health council, we will be opening it up in February to nominations, and then we'll hold the elections in March for chairperson, vice chair, secretary, treasurer, and then the elected board members. Upcoming topics next month with the nominations, we're going to have Ann Hines, who is doing a survey in the community. They're going to discuss what that survey is about. And then we've got a heart cardiac presentation from the heart cardiac people. I still have March is open, so if anybody wants to present in March, let me know. What I do is 2 groups, the same basic, same topic, so that way it's 2 different perspectives on it. So if you have something that you want to present, let me know, and then we'll find the second one to match up with it. April is youth trauma, and I'll need 1 more group into the youth trauma one. The Together with Veterans Steering Committee meeting is January 17th, and y'all don't need to know that because that's steering. The Behavioral Health and Wellness Committee will meet January 21st at Alianza, 1200 South Richardson, from 8 to 9. If you want to get more involved in the behavioral health pieces, this is the meeting to come to and start attending, because this is where we do a lot of the work on that. The next membership meeting, which is this, is February 11th. The 211 report is after that. This will be the last, December is the last month. The 211 report will look like this. We changed our system over. We're working in the Chaves County 211.org to start building out the resources there and start collecting the data. So once I start seeing how reports start looking, I'll start modifying and changing so that we know what resources we need within the community. And with that, that is all I have on the agenda. Anybody have a remark that you can state within like 5 minutes?
I do. I want to answer about, the stigma again. I used to be a health defense specialist rally on that one point, and we were trying to get gay bikes everywhere, and we went up against the police and them. They came, covered tire slaps in our own building and on our facility on Second, and so that is still scary. She wants us to partner with the police and all that. I'm not saying all.
Okay. Okay, Ernie, so I'm going to go ahead and I'm going to stop that there. So the debate with the city and Christina needs to happen outside of this, okay?
Okay.
Sorry. Val?
I don't know, 9 years now, and it's time for some new blood and time to consider the new leadership. So I will not self-nominate as the chairman of council, and that means that position is open. I have urged our second in command to solicit their self-nominate as the chairperson position, but if we are still led to lead this, this is a great opportunity to build that experience and to invest in the community. Because I have myself involved in the health council and health, and I've been connected to it ever since, and I will continue to be a part of it, but I just will not be it. I think it's time to be led, I think it's time for leadership, and I hope that we can search of arts to do that with all other positions, right? I mean, pretty much stay in those positions because one really does step up the way and have to be considered doing that.
So for those on Zoom that didn't hear, Val is not going to renominate for the chairperson. She is taking a side seat. I'm not going to say a back seat. She's going to take a side seat and open it up for others to lead at this point. So she's encouraging those who feel the need to lead to step up and throw in a self-nomination on this. Anything else? All right, with that, it is 11:06 and I call the first 2026 Health Council meeting to an end. Thank you guys. I appreciate y'all being here and providing your input. Again, we'll have more of these kind of meetings, and so we'll be sharing it out. So pay attention to your emails. Thank you, guys.
Thank you.